You're watching Coronavirus in Context. I'm Dr. John White, Chief Medical Officer at WebMD. I'm joined today by Dr. Laura Riley. She's chair of the Department of Obstetrics and Gynecology at Weill Cornell Medicine. Dr. Riley, thanks for joining me.
Thanks for having me.
Let's start off with, how has the coronavirus epidemic changed labor and delivery?
The virus has changed everything. The biggest changes on labor and delivery are that because we're in New York City where coronavirus is widespread, we have started doing universal testing for all pregnant women. So what that means is that as a pregnant woman comes in and is admitted, she has a nasopharyngeal swab for PCR of COVID-19. And based on that information, we then wear the appropriate protective equipment for providers. We mask all patients and their support persons. All of us are wearing masks throughout the labor and delivery. And then if mom turns out to be COVID positive, we make sure that, if she needs a cesarean delivery, the whole team is aware and we minimize the number of people who need to be in the room to do the surgery. We take precautions on the off chance she needs to be intubated because we know that will aerosolize COVID-19. And then in terms of the baby, if the mother is COVID-19 positive, we're all concerned and cautious about, transmission to the baby, but so far we've not seen that that's a particularly efficient way to get the disease for newborns, thankfully. And so we put the baby in an isolate and ask the mother to stay 6 feet away, to the extent that she can.
How long do you try to keep them away 6 feet?
Well, certainly through their whole hospitalization, and actually because they are COVID positive, we're sending the family home and asking them to self-quarantine as well for, public health reasons. And then we want her to stay, separated from the baby for, at least 7 days, wearing a mask and all those precautions. And her partner should do the same, or her support people should do the same, because what we want to avoid is the baby getting COVID-19 after birth.
But wearing a mask, et cetera, how realistic is that in the setting of, a mother and, a partner trying to take care of their child?
Yeah, it's not easy, and I think it's just, yet another stress for families. I think it's hard enough to take home a newborn in the best of environments. Taking home a newborn and then needing to do all these different things and stay quarantined is absolutely difficult. But I can tell you, having had a few patients now with COVID-19 who have gone home, they are absolutely doing the very best they can because they're scared for their children and they really don't want their babies to become infected after birth. So, I think that people do the best they can with the masking, with washing their breasts before breastfeeding, with keeping that distancing that we've asked them
as much as you can realistically.
As much as you can realistically. I would say one thing that is important is that babies are being tested at about 24 hours after. And so far, we have not had any positive babies from birth. So moms are going home knowing that their babies are negative. And so there's a huge motivation to keep that to keep that going. And then they're coming back a week later to be retested. And my experience has been is that my patients have made every possible effort to do that.
Do we know if COVID-19 puts a pregnant mom at greater risk? And do we know if transmission is, how probable is that to the child?
Yeah, so, this is the biggest question in obstetrics, honestly. What we can say is that, when H1N1 was an epidemic, we definitely saw fairly soon after the epidemic got going, we saw that pregnant women had greater severe morbidity following H1N1.
Okay.
We have not seen that same uptick in severe morbidity. I think what we have to be cautious about, though, is the numbers reported are still small. And the second thing is that just because pregnant women may not have more morbidity, pregnant women are still going to get sick. They're like anybody else in the general population. And we see that lots of people in the general population, even the younger people who didn't expect were going to get sick, have gotten sick.
Do pregnant women need more precautions?
You know, I think pregnant women need to take the same precautions that everyone is taking. And I try and go over that at every single visit that I see patients or that I'm doing my video visits. We're trying to be very, I'd say, conservative about which times we're doing those video visits. And it's not for every patient. You know, some patients with comorbidities, you know, you've got to weigh the risk of coming into the hospital because we know people with comorbidities are at greater risk for severe morbidity from COVID-19. But by the same token, those people tend to need more monitoring, more fetal monitoring, more ultrasounds, non-stress tests, whatever. And those are not things you can do, remotely.
There was a recent report that said hospitals are still the safest place to deliver a child. But what do you say to those moms who are concerned about going into the hospital? And maybe, especially for those moms that were thinking about delivering in the hospital, and now they're looking at other options.
Yeah, I completely understand. And I think that there's so much fear around getting COVID-19 and recognizing that some people do very poorly if they get it. We're making every single possible effort to minimize risk within the hospital. At this point, there's so many permutations on, sort of what's being done. Some places it's happening right when you enter the hospital. Other places it's happening before you enter the office suite. We're doing it twice, actually. You enter the hospital and then you get to the office suite. I think the other thing is that, we're testing all pregnant women as they walk through the door, in labor so that we can understand, who needs to be on this side with this amount of PPE and these precautions, and who needs to be in this room, away from that. So I think, again, I feel like the hospital really is a safe place. I think the other thing that makes it a safe place is that, hospital staff are so, in tune to everything about COVID-19 and all the possible ways that, it could be possibly, transmitted, that I think that they're, hyper aware.
What do you say to those pregnant moms who are perhaps affiliated with hospitals that are not allowing spouses and partners in, or limiting the ability for someone to be with them, or the amount of time? Is that a factor in terms of deciding where to give birth? Because we know that, having a partner with you sometimes can reduce stress and anxiety. They can be someone to be on the lookout for potential challenges. Should that factor into a woman's mind when deciding where to deliver her child?
We went through a short period, like 7 days, where we restricted visitors, and we did that thoughtfully. I've been practicing for 30 years, and to be honest, I couldn't imagine that we find ourselves in that situation where we would be restricting visitors. But we really did it out of an abundance of caution and worried about safety. Our biggest concern is to protect mom and her baby. So we want mom to have a mask, provider to have a mask, and support person to have a mask. And at a time when we were a little concerned that there weren't going to be enough masks, we had to make a decision. And the more exposures, the more opportunities you bring into the hospital, and the more unknowns you bring into the hospital, there's more exposures. So thankfully, all things have worked out in terms of availability of more PPE, availability of more testing, availability, of just understanding the disease a little bit better. And so we're back to where we, normally would be, which is, a support person, for labor and
But
delivery.
everyone doesn't allow that still. And to be fair, that was done through an executive order by the governor in New York. So how should women consider that, whether or not they're able to have a support person with them? Is that an important factor in deciding where to give birth?
I think for some women that is an important factor. I mean, I think, for all sorts of reasons that added support, is necessary for some women. I think that what we found is that not all women were completely put off by that, and they, accessed other things that we tried to put in place. So the virtual doula, the support of the team that was there, and FaceTime the support person, through labor. So I think that it's an acknowledgement that that doesn't work for all women, and for those women, there are other options. I get it.
Any other advice for pregnant women during this pandemic that we're experiencing?
Yeah, I do worry about sort of the anxiety and the stress that this whole situation puts on everybody. And then I think, pregnancy is probably one of the most anxiety provoking times in a woman's life, and in a family's life, right? That, for whoever is having this newborn. And so I think that COVID-19 adds a whole new level of anxiety for both the medical concerns as well as, the social isolation, the lack of support once you're home, even though you have your support person. A lot of us are used to having our mom, our, whoever, our friends help us. And so I think that pregnant women who are experiencing more anxiety, more depression, more whatever, need to speak up, because there are resources out there in a way that I have not seen in the past, whether that be psychologists, psychiatrists, people really sort of rallying around women. And I think that that's super important.
Well, Dr. Riley, I want to thank you for taking time to speak with us today.
My pleasure.
And I want to thank you for watching Coronavirus in Context. I'm Dr. John White.